In today's Eye on Health, it's not what anyone really wants to talk about, but it's a very important message to mention this time of year. We're talking about the danger of holiday burns, especially when you're in the kitchen doing your holiday baking and cooking.
Yeah, I speak with an AHN specialist about how to prevent those burn injuries and why young and elderly people are at high risk for injury.
Cooking burn injuries are the most common burns that we treat. And with the increase in cooking that happens obviously around the holidays, the incidence of accidents also increases. Particularly this year, burn centers nationwide have seen an increase in the number of cooking-related injuries, and obviously this is related to the pandemic. People are staying home, and naturally they're cooking more. Hot stoves, hot pots and pans, boiling water. Microwaves can also heat foods to dangerously hot temperatures.
He says young people and the elderly are at high risk for a burn injury.
Scalding injuries, whether from boiling water, hot grease, or even tap water, is one of the leading causes of death for children under the age of 4.
And elderly people may have physical, mental, or visual impairments that can make it tough for them to cook safely.
Maybe they can't lift heavy pots and pans as easily as they once did. Both elderly people and children have more delicate, thinner skin, so they will burn more quickly and deeply. In general, don't rush, don't take shortcuts, because usually that's when we see most of the accidents happening. Another important fact to remember is that third-degree burns will not hurt. So patients many times will think that the injury is not that severe.
He says if you do get a burn, immerse it in cool water or use a cold compress. Never use ointments or butters. And if it's a large burn or involves a young or elderly person, seek medical attention.
We have complications that can happen immediately, such as infections. And then we can have complications that are related to not getting the proper care in the beginning. That may lead to contractures, limitation of movements, of extremities, and then sometimes this has to receive surgery in order to recover from this problem. This is extremely important, but in every case, make sure you have smoke detectors and fire extinguishers that are in working condition.
Yeah, that was good information there. Yeah, all right. Remember to keep watching for our Eye on Health series here on PTL. Every Wednesday, it's brought to you by Highmark, Blue Cross Blue Shield, together with Allegheny Health Network for your health.
Thanks, Mikey. Great stuff. And coming up next on PTL, you can get Rainia's recipe for fun cranberry, not Granberry, bliss bars. This is actually a copycat recipe from a popular coffee shop that you might recognize.
Yep. Also ahead, get ready to celebrate the holiday season with Garth Brooks and Trisha Yearwood. We're talking with them live from her home studio to find out what they have planned for a Sunday night special. Can't wait.